Pneumonia is one of the leading causes of death, especially among children. Studies show that about 36,000 children die from pneumonia every year in Uganda. The situation is dire in rural areas where public health facilities have very little or no supply of pediatric formulations, including the amoxicillin suspension. This is a newly recommended drug for treating pneumonia. A new study found availability of amoxicillin suspension in rural areas at just 11%.
We saw that there was an improvement in medicines for diarrhea, but medicines for especially pneumonia were really low.
Yet another essential medicine, cotrimazole syrup, was found to be at 16%, alongside metronidazole syrup used for treating bacterial infections among children.
When we are in the field, we are often told that they are not requisitioned for because it's bulky.
The national medical stores is dependent, of course, on the national coffers. That means it can afford based on how much we as the government or as the people of Uganda give it to provide for us these medications.
The study was conducted by the Medicine Transparency Alliance, a group of civil society organizations working with government and the National Drug Authority to monitor the availability of medicine and their prices in Uganda. The study was conducted in 4 geographical regions and covered 120 health facilities in rural and urban centers. People living with non-communicable diseases like high blood pressure and diabetes were also found to have challenges.
It's about the people who should be also there to provide that care. If the people are not there, naturally, in the records of use or of consumption of a particular product, NMS will not see that particular product in its system.
The study also found counterfeit and substandard medicines on the Ugandan market.
The drug moves along the supply chain from the manufacturer through importation, through the distributors, up the end user. So, probably along the supply chain, if the drug, for example, is not well stored, is not well handled, it can deteriorate.
If found to be of low standards, the brands under scrutiny would be banned from the Ugandan market. Irene Namyalo.